rahmatullahi ta'ala wa barakatuh. We will talk about hand. The bone of the hand divided into carpal, metacarpal, and phalanx. Again, the carpal bone consists of 8 bones arranged in the proximal row and distal row, which are scaphoid, leonate, triquetral, and pisiform. In the distal row, trapezium, trapezoid, capitate, and hamate. Okay, here is metacarpal bone, which has a base, heads, and shafts. Phalanx also are long bone, has proximal part, distal part, between them are shaft. Okay, when you remove the skin, you can see the palmar aponeurosis. This palmar aponeurosis is the thickening of the deep fascia, which protect the underlying structures, such as the vessels and nerves. The palmar aponeurosis is triangular in shape and has apex, which provide attachment for palmar's longest muscle, and the distal part or the apex, the base of the palmar aponeurosis, divided into 4 slabs that continues with the fibrous tendon sheath of the digit. Okay, the hand divided into compartments, the palm of the hand divided into 4 compartments or 5 compartments: hypothenar, thenar compartment, adductor compartment, central and interossei compartment. We have carpal tunnel. This tunnel formed by the carpal bone and flexor retinaculum. Flexor retinaculum also is a thickening of the deep fascia that attach to the lateral 2 bone and medial 2 bone of the carpal bone. So it attached to scaphoid and trapezium laterally, pisiform, and hamate medially. This is the carpal tunnel, which provide passage for tendon of flexor digitorum profundus and flexor digitorum superficialis, flexor pollicis longus, and median nerve. This median nerve may compress here and give rise to carpal tunnel syndrome, pain in the hand, known as carpal tunnel syndrome. Structures that pass above the flexor retinaculum are palmar aponeurosis, ulnar artery, and nerve, which cover in this area by deep fascia and form guyton passage. Muscle of the hand divided into 4 groups: thenar, hypothenar, lumbrical, and interossei. The interossei also divided into 2 compartments or 2 groups: palmar and dorsal interossei. Thenar and hypothenar group carry the same name: abductor, flexor, and opponents. So when the thinner muscles belong to the thumb, we add pollicis. For example, this one is abductor pollicis brevis, because we have abductor pollicis longus in the forearm, and this one is flexor pollicis brevis. Brevis means short. When you abduct or remove these two muscles, you can see the opponent's muscle. As you see here, we remove the abductor, you can see opponents. These three muscles form the thenar eminence, and we have the fourth muscle which belong to the thenar group but not participate in the formation of the thenar eminence, which is adductor pollicis. So the thenar muscle include abductor pollicis brevis, flexor pollicis brevis, abductor peripherally. Okay, abductor peripherally. This one is abductor pollicis brevis. This one is flexor pollicis brevis. This one is opponent's pollicis, and this one is adductor pollicis. Abductor pollicis, flexor pollicis, and opponents originate from the flexor retinaculum and tubercle of the scaphoid and trapezium, while the adductor pollicis has two heads, oblique head and transfer head. The oblique head originates from the base of the second and third metacarpal bone, and the transfer head originates here from the shaft of the third metacarpal bone. The two heads inserted in the base of the proximal phalanx. Okay, the origin of this muscle. The insertion of these three muscles, abductor pollicis brevis, flexor pollicis brevis, and adductor brevis, inserted in the base of the proximal phalanx of the thumb. The action very easy from their name. Flexor pollicis flex the thumb, abductor pollicis abduct the thumb. Opponents response for opposition التسبيح. The four muscle named as adductor pollicis. This adductor pollicis has different nerve supply, which supply by deep branch of the ulnar nerve. Okay. Deep branch of the ulnar nerve, while abductor pollicis brevis, flexor pollicis brevis, and opponents supply by recurrent branch of median nerve. Again, the insertion and nerve supply, because the action very easy, origin also very easy. Insertion. The flexor pollicis brevis, adductor pollicis brevis inserted in the base of the proximal phalanx, while opponent's pollicis inserted in the shaft of the first metatarsal bone, first metacarpal bone here, inserted here. Okay, nerve supply. All the muscle supply by recurrent branch of the median nerve, except the adductor pollicis brevis. Adductor pollicis brevis is supplied by deep branch of ulnar nerve. Hypothenar muscle. Hypothenar muscle carries the same name. Abductor, flexor, and opponents with the same arrangement. Abductor peripherally. This one is abductor digiti minimi because belong to the little finger. Abductor digiti minimi, flexor digiti minimi. When you remove two muscles, you can see opponents digiti minimi. Okay? All these muscles originate from the hook of the hamate and flexor retinaculum, and the insertion of flexor digiti minimi, flexor digiti minimi, and abductor digiti minimi inserted in the base of the inserted here in the base of the proximal phalanx, while opponents inserted in the shaft of the fifth metacarpal bone. The nerve supply, all these muscles supplied by the branch of ulnar nerve. The action from their name. Abductor digiti minimi abducts the thumb. Flexor digiti minimi abductor digiti minimi abducts the little finger. Flexor digiti minimi flex the little finger. Opponents digiti minimi responsible for oppositions. Okay? The lumbrical muscles are 4 in number, numbering first to 4 from lateral to medial. This is the one. First, second, third, and fourth. This muscle originates from the tendon of flexor digitorum profundus and inserted in extensor expansion. This one inserted dorsally in the extensor expansion. As you see, the first and second lumbrical are unipennate, while the third and fourth are bipennates. The nerve supply as the innervation of flexor digitorum profundus. How is it? The first and second by median nerve. The third and fourth by deep branch of ulnar nerve. Okay? The action of this muscle responsible for writing position, flexion of carpometacarpal joint and extension of interphalangeal joint. البوزيشن ده بنسميه شنو؟ writing position. The interossei muscle divided into two groups, dorsal interossei and palmar interossei. The palmar interossei are unipennate and 3 in number, while the dorsal interossei are bipennate and 4 in number, numbering the interossei also from lateral to medial. The nerve supply of the dorsal and palmar interossei by deep branch of the ulnar nerve. So the dominant nerve in the hand is ulnar nerve. The dominant nerve in the hand is ulnar nerve. The insertion of this muscle joins the dorsal expansion. The action of this muscle by acting with the lumbrical muscle give writing position, flexion of metacarpophalangeal joint and extension of interphalangeal joint. The dorsal interossei also produce abduction of the finger, while the palmar interossei produce flexion of the finger. So this one Abduction, when you separate the finger from each other. Adduction, when you move the finger toward each other. Okay, this is the interossei muscle. The doors, the palmar 3 in number. The palmar 3 in number are responsible for adduction. This one has no dorsal interossei and the thumb also. So they inserted in the dorsal expansion of the second, third, and second, fourth, and fifth finger, while the palmar interossei are 4 in number and inserted in the dorsal expansion of the second, third, and fourth finger. Okay. This is the dorsal expansion. Dorsal expansion provide attachment for extensor digitorum, lumbrical muscle, and interossei muscle. This dorsal expansion divided into central slip or central tendon and two peripheral tendon. The central tendon inserted in the base of the proximal phalanx, and the two peripheral tendon inserted in the base of the distal phalanx. Okay. We already described the anatomical snap box with the muscle of the posterior compartment of the forearm. Let's move to the nerves. The median nerve passes through the flexor retinaculum and then give rise to recurrent branch of the median nerve. This recurrent branch responsible for supply the abductor pollicis brevis, flexor pollicis brevis, and opponens pollicis. Also, the median nerve supplies the first and second lumbrical muscle. In the forearm, the median nerve gives sensory branch to supply the center part of the palm, and the median nerve terminates by give rise to digit nerve that supply the hand. Okay, this is the median nerve. The median nerve in the forearm give rise to palmar branch. This palmar branch supplies the central part of the palm and then pass through the flexor retinaculum and give rise to recurrent branch. This recurrent branch supplies the thinner muscles except the adductor pollicis and then divide into digit nerve. This digit nerve supplies the lateral 3.5 finger and also supplies the distal half of the 3.5 digit. Here, this area supplied by median nerve. The ulnar nerve. The ulnar nerve is the dominant nerve in the hand, which supply the adductor pollicis, the thenar muscle, the interossei muscle, supply the third and fourth lumbrical muscle, and then give here. This is the ulnar nerve. Also in the forearm, give rise to palmar branch that supplies the medial third on the palm of the hand. and then pass through the gut, pass above the flexor retinaculum. And here in the hand divided into two terminal branches, superficial and deep. The superficial branch is a cutaneous and supply the medial 1.5 finger, and also in the dorsum of the hand here one and half finger. This is a summary of innervation by the this is a summary. The 1.5 finger on the palm and the dorsum, and 1/3 on the palm and the dorsum of the hand. This area colored by green. This area supplied by ulnar nerve. The medial nerve supplies the medial 2/3 of the palm of the hand. 3.5 finger on the palmar aspect of the hand, and the distal half of 3.5 finger on the dorsum of the hand. Okay. Regarding the radial nerve, the radial nerve under cover of brachioradialis in the upper part of the forearm divided into superficial branch and deep branch. The superficial branch is cutaneous and responsible for innervation the lateral 2/3 on the dorsum of the hand and 3.5 fingers. Okay, this is a summary for the areas that supplied by 3 nerves. This is the radial nerve. Here color by orange. That is all regarding the upper limb. Wishing for you all the best, inshallah.